your take on this withdrawal?
I support President Biden on this, and I think it's important when a Republican can agree with a Democrat that we actually talk about it, because people think that we never can get along and never agree. But I do agree with President Biden. I've been asking for an end to the Afghan war for a decade now. I think the military mission is long since gone. It's become a nation-building enterprise, and really, they've been fighting each other. They were killing each other before we came. They'll kill each other after we go, but it's not really in our national interest to be spending $50 billion a year over there. And besides, if we want to build some roads and bridges here, one way to pay for it is to quit spending $50 billion a year building roads and bridges in Afghanistan.
Is it walking away with our tail between our legs without a clear victory declared in leaving the country?
I think not. 20 years ago, we passed a resolution, and this was a resolution to go to war with the people who attacked us on 9/11 and anybody that harbored them or aided and abetted them. I would have voted for that, and I was for that. We got in, we did that in the first year or two. We got rid of the Taliban that had hosted Osama bin Laden, and we also went after and chased him into the mountains and ultimately killed him. But none of those people are left anymore. The goal that Congress voted on was to eliminate those people. We did. Now it's become a nation-building exercise. There's a long-standing civil war there. I think we did win, and so I think it's important that we declare victory. We should have declared victory a long time ago, but either way, it's time to come home. Doesn't mean the world will be a perfect place when we get home, but we need to be aware of conflict and aware of potential danger everywhere around the world, not just in Afghanistan. By having so much emphasis on Afghanistan, I think we take our eye off a lot of other parts of the world where we could have potential attackers.
Let me talk to you about something going on back here at home, and that is in Kentucky. This week, Governor Beshear declared that 2.5 million Kentuckians need to be vaccinated before he'll ease restrictions on venues that hold less than 1,000 people. What is your take on that? We've done the math, and while he says it could be 3.5 to 6 weeks, it looks like it's going to be at least 3 months if we keep up the demand right now for vaccinations.
I'm for people voluntarily choosing to get vaccinated, particularly people at high risk. I think they ought to be vaccinated. It's their choice, but I think they ought to be vaccinated. As far as the government's edicts and mandates, they're illegal. The state legislature passed a law saying that if he wants to mandate behavior and he wants to be the dictator of the economy and dictate all of our behavior in Kentucky, that he has to get permission from the state legislature. Now, he's fighting this in court, but what he's saying in court is that he has unlimited powers. These are inherent powers that somehow God gave to him that nobody can take them away from him. I think that's a very, very dangerous argument. It would lead to unlimited power. He's already tried to exert this in closing down religious schools as well as closing down churches. Each time the court has rebuked him. I think now the state legislature has rebuked him, and still yet he continues to carry on thinking that he's somehow king and can do what he wants. I think it's eventually going to go to court, and I can't imagine that the court will allow a governor to claim they have unlimited power.
But to say that 2.5 million people have to be vaccinated before you ease back restrictions, we've heard from people with the restaurants associations, we've heard from people who, we've heard from other lawmakers and such say, it's just unreasonable. It's an unreasonable limit, and so can we not have our business back until people agree to be vaccinated?
I do agree that it's unreasonable for him to get involved with this at all. He could give suggestions. He could try to point to some science. He's not pointing to any science. He snatched a number out of the air and said, oh, when we reach this number. So what I would say is that in a free society, people will make their own decisions. You're starting to see this. As you go out and you see people that are over 70 in a restaurant, you ask them, have you been vaccinated? They're all smiles. They've been vaccinated. They say, we're glad to be out and we're not wearing our masks. Dr. Fauci and Governor Beshear could tell us what to do, but we're going to make our own decisions based on our own assessment of the risk. And this is good. It's good for our restaurants, good for our hotels, good for people to get out. And we're at a point now where a third of the country has gotten COVID naturally. A third of the country has been vaccinated. The numbers being vaccinated go up a couple of million people every day. We are rapidly approaching a time in which we will have enough immunity, either natural or from the vaccine, that we're going to be having less and less deaths. Right now, age 75 and above, 75% of people have been vaccinated. That's important because most of the deaths were 75 and above. So our death rate I think will continue to plummet, and I think really within a month we're going to be hopefully getting back to normalcy. But we don't need Governor Bashir to decide that. In a free society, every individual and every Kentuckian gets to decide that.
The Johnson & Johnson vaccine that was put on, do you agree with the pause? Should they put a pause on that vaccine?
Yeah, probably. What I would say with the vaccine is you have to look at the risk of the vaccine versus your risk from the disease. If you're over 75, all the vaccines, probably including Johnson & Johnson, are safer than the disease. If you're under 25, as you start to see a problem with a vaccine, there's a possibility that the danger of the vaccine could be equal to the danger from the disease. So, for example, under 25, the death rate's 1 in a million. We've only had a couple of deaths from the Johnson & Johnson vaccine. They're being investigated. But, you can see how you'd be a little apprehensive if you're 20 years old, you don't have any health problems, and you're not too excited about it, and they tell you that you can get a blood clot and die. It's very rare. But then they also, if they're honest, will tell you, well, it's very unlikely that you would die from COVID. You have to weigh those balances. And that's why I think if we want to be honest with people, they're more likely to take the vaccine. If we're honest and say under 25, there's very, very small risk of the virus. Above 65 or 70, there's a 1,000-fold increase in it. And I think you're seeing that naturally. Why have 75% of 75-year-olds gotten vaccinated? Because they're assessing their own risk to be greater for the disease. So I think people are smarter than we give out to them, and I think we'll see what happens with the Johnson & Johnson. I predict it'll actually be back on the market, but I think you assess your risk depending on your age, your body weight.